Hi there, welcome back to the Wilkin Center for Psychotherapy's YouTube. My name is Timothy Meyer. I'm the Assistant Clinical Director here at the Wilkin Center, and I am joined today with Gabrielle Ferrara, who is one of our psychotherapists here. And today, Gabrielle is going to be chatting with us a little bit about ERP for OCD. And so, Gabrielle, thank you very much for being here. And take it away.
Thanks, Tim. I'm happy to be here. So ERP for OCD is known as the gold standard treatment for obsessive-compulsive disorder, and it stands for exposure and response prevention therapy. So that's the ERP. And what ERP does is it allows the client or the person who's struggling with OCD to experience their fears or their anxieties and practice not engaging in compulsive behaviors. So for example, someone who has contamination fears, so they're afraid of germs or getting sick or something like that, a therapist may work with them to do exposures for that fear, such as touching doorknobs or shaking hands or other sort of potentially triggering situations, and then work with the client to not engage in those responses, those rituals, such as going to wash your hands right away, using hand sanitizer, not eating with your hands after doing those activities. So what it does is it allows the client to be purposefully exposed to some of their fears and their anxieties, and then practice not engaging in those responsive behaviors that short-term alleviate the anxiety, but long-term just exacerbate that obsessive-compulsive cycle. So over time, the anxiety goes down, but in the moment it is pretty distressing. It is a pretty, difficult type of therapy, but research has shown us that over time, the anxiety does go down and it does decrease the more you do these exposures and don't engage in those rituals or those compulsions afterwards.
Got it. So it sounds like the idea is to expose someone to the thing that actually makes them feel very uncomfortable. And then the response prevention is we're preventing the action that typically follows when someone is, I'll say, triggered by that thing. So could you give me an example?
Yeah. And I just want to touch on what you said too, is it seems a little counterintuitive, right? So it seems a little bit like, why would we purposefully as therapists make our clients more anxious or more distressed, right? And it seems a little counterintuitive, and it is to some degree, because in a lot of ways it's a little bit of an overcorrection. So you kind of do this hard thing that might be a little bit out of the realm of normalcy or kind of those day-to-day normal behaviors, and by not engaging in those responses, the normal stuff doesn't seem so scary anymore. So for example, there's many different types of OCD and many different themes, so I won't be able to touch on all of them today, but going back to kind of my contamination example, that's kind of a very concrete example. A therapist and a client might be in a session together, and in the beginning of the session, we use a metric called subjective units of distress, so SUDs. And some therapists use 0 to 10, some use 0 to 100. It really is, though, just a metric to identify the client's level of distress before doing the exposure. And so say a client has some contamination fears, some fear of germs. The therapist might say, okay, we're going to do an exposure today. I'm going to ask you to touch the doorknob and then shake my hand, and then we're going to maybe have a snack together and not wash our hands first. And, the therapist says, I'm going to do it with you. You're going to do it as well. We're both going to be doing this exposure together. That's a really important part of ERP too, is that collaboration between the therapist and the client. So both parties are doing the exposure together. And before the exposure, the therapist will ask the client, where's your anxiety level? What's kind of the subjective unit of distress? And then, they'll do the exposure together. Again, check in on subjective unit of distress, and then engage in that response prevention piece, which is not washing your hands, not sanitizing, not, having a clean hand and a dirty hand. That can be a compulsion sometimes too, is, if I touch the doorknob with this hand, I'm going to eat with this hand because this is the clean hand. So not engaging in any of those sort of avoidance or rituals around that exposure. And then, we sit with that anxiety, we sit with that uncertainty together. And it's really, really uncomfortable, and it's not a fun time, but we sit with it. We sit with the uncertainty, we sit with the discomfort. And after, a certain amount of time, we check in again on that subjective units of distress level. And we talk about, has it gone down a little bit? Is it still pretty high? What can we do to kind of continue to sit with this uncertainty and get through it together?
So it's really about intentionally bringing that anxiety up, and not doing the action that typically folks do to ease the anxiety,
Mhm.
and just allowing the suds to go away on their own.
Yep. Mhm.
This is hard work.
It's very hard work.
And if you could just speak to why it's worth it.
Yeah, absolutely, absolutely. So again, sort of like I mentioned a little bit earlier, by doing this very hard work and these very difficult exposure tasks and things like that, it makes normal, quote unquote, normal life a little bit easier. So, for example, by purposefully exposing yourself to the germs in the doorknob, or shaking hands, or those types of things in the therapy room, when you go out into the real world and say go out to dinner with your friends or something like that, and there's a bread basket on the table, and you're like, "Ooh, that looks really good." You're able to grab a piece of bread and enjoy the meal with your friends and not be afraid of the germs necessarily, or have to go sanitize your hands real quick, run to the bathroom. So it kind of makes those normal day to day life things a little bit more natural and fluid and manageable. So we have to overdo it to some degree to be able to come back and live a life that's meaningful and live a life that's valuable without those fears kind of running the show.
Great. Yeah. So it's definitely hard work, but it's definitely worth it.
Definitely worth it. Definitely worth it.
All right, great. Well, Gabrielle, thank you for the explanation of ERP. It's tough work, but it's very good work.
Mhm.
And if I will recommend that if anyone is interested in ERP for OCD, I definitely recommend that you reach out to a local therapist who's trained in it, such as Gabrielle.
Thank you, Tim. Thanks for having me.